Hello and welcome to Eldercare Academy. Today's topic is going to be how do Medicare supplements work? How do they work? How can you present to your clients? That's what we're going to talk about today. When you sell Medicare supplements, it's important to know how to explain how they work with Medicare Parts A and B, and that can sometimes be a challenge. So, I'm Jennifer Harris. I'm a 16-year veteran in this industry, and today I'm going to show you how to explain Medicare supplements to your clients in a simple, easy way that they can understand. So, let's get started. So, all the time, in many years of working in this industry, I get asked all the time, how do you sell Medicare supplements? I'm a licensed insurance agent myself, so I actually do sell Medicare supplements to clients. And so I get asked this question all the time. How do you sell Medicare supplements to customers? What is your presentation? How do you make it easy to understand? And with my experience here at Eldercare, we've been in the Medicare supplement industry for over 40 years. We have thousands of agents that ask us how we can help them understand how to sell Medicare supplements and how to present those to your clients. And that's what we're here for. We're here to help you learn and grow and how to increase your volume of sales and help more clients than you've ever thought possible with selling them a Medicare supplement. Broke it down into 6 simple steps for you on how to break down to your client how to sell a Medicare supplement. So how I explain Medicare supplements is I've got a client, Miss Jones, in front of me, and I start by telling her that Medicare supplement insurance companies are all identical. They all have the same coverage. One does not have more benefits than the other. That's the difference between a Medicare supplement and different plans such as Medicare Advantage. Medicare supplements, all the plans, all the benefits are the same from company A to company B. Next, what I want to explain, Ms. Jones, is that all Medicare supplements are federally regulated. So that's the reason that all the plans are the same. The federal government says that I can offer you plans A, B, C, D, F, G, K, L, M, or N. So I know that sounds like a lot, but we're going to focus on probably 3 primary plans that I feel is the best fit for you. And then I go in and I explain, out of those plans, I recommend F, G, or N because they pay the lion's share of the bills for you. So on this, and I actually do this, I have an outline of coverage in front of me when I'm presenting that to my client, and I will show them all of the different plans, and then I highlight which plan that we have decided at the end of the presentation that we're going to write them. And that way, you're required to give them that outline of coverage, but it lets them go back and reflect on, what does their Medicare supplement cover. The next, I'm going to explain to them how original Medicare works. So Part A of Medicare, Part B of Medicare. So Part A of Medicare is your hospital. Everything that you can think of that is hospital related is going to be covered with by my Part A of Medicare. Part B is your doctor. By the time they're talking to you, they probably already have both Part A and Part B, but some may not. So some may be getting ready to get Part B, and so you just explaining that to them. More information is always better to explain to them, the difference between Part A and Part B. The deductible is sometimes what's confusing and can differentiate between different plans. So the Medicare Part A deductible is $2,800 for 2024. This is covered by your plan. The Part B deductible is $240 for 2024. So if you have one of those top 3 plans that I talked about in the beginning, F, G, or N, Part A deductible is covered. You should never receive a hospital bill, doctor bill, anything if you choose one of those plans. So, Miss Jones, if we write you on a plan F, G, or N, now we're going to get to the F. Most of the time, F is not, if you're writing someone that's turning 65, F is off the table. It's not an option for them. But if I'm writing them a G or an N, you should never receive doctor bill, hospital bill, anything. You can go to any doctor, any hospital in the country. There's no networks. You can go to whatever doctor, whatever hospital that you need to, and you should never receive a bill. If you receive a bill, then something's wrong and I need you to contact me. Either the doctor office has filed it wrong or something like that. We need to figure out why you received a bill. If Medicare pays 1 penny towards that claim, then your Medicare supplement plan G or N will come in and typically pick everything up. More on the G, N we're going to break down here in just a minute. And this is the part where I'm talking to my clients and I'm saying, hey, let me break it down for you. If you go to the doctor or the hospital and you have a $2,000 doctor bill, Medicare is going to pay 80% of that bill. So they're going to pay $1,600 towards that bill. What's left over is $400. So if I have a plan G, it's going to come in and pick that up, the rest of that 20% at 100%. It's going to pay that bill. I'm not going to have anything left to pay on that. If I go the option for plan N, there are some differences, right? You know, the 100% of the excess charges are not picked up if I have a plan N. But the great thing is that if the doctor accepts assignment, meaning if they go ahead and accept what Medicare pays, then you won't have the remaining balance of that. Most 90 to 95% of doctors and hospitals accept assignment, which means they accept the amount that Medicare pays towards that bill and they don't bill the client for that. But it's really important that customer, Miss Jones, that you understand that if your doctor or hospital, if they're a specialist, sometimes they think they're special and they don't accept assignment from the doctor, that you could end up with a bill. And we're going to break down plan N just a little bit more later over this. But I talked about plan F earlier. So plan F, in 2020, they took plan F off the market for anybody that was not Medicare eligible prior to January 1st, 2020. So if I'm turning 65 in 2024, I cannot get a plan F. But if I had a plan F prior to January 1st of 2020, I can switch from plan F to plan F. So that plan F is still available. It's just not available for aging in. For plans K and L, which I don't sell ever, but after you meet the out-of-pocket yearly limit and your yearly Part B deductible, then the Medigap comes in and picks up at 100% and covers services for the rest of the calendar year. So Plan N pays 100% of the Part B co-insurance. So you must pay up to a $20 copay when you go to the doctor in some doctor visits, some $50 up to a $50 copay for the emergency room visits that don't result in inpatient admission. So there's the difference, and you might have more questions, Miss Jones, and we can figure that out, and we can answer those questions. Let's figure out which plan best suits you when we get to looking at the cost of the difference between these two plans. And that's really how we break it down. And that's how I break it down. Like I said, I present them with an outline of coverage. I'll pull the rates for them, and I will actually show them, look, Here's the difference between company A and company B. The only difference between company A and company B on a Medicare supplement plan is going to be the rate that you pay or the underwriting. So if I'm outside of my open enrollment and I'm wanting to just switch from one plan to another, that's when the underwriting is going to come in and be a factor in this, because every company has different criteria to pass underwriting. So that's the only difference. But Miss Jones, you're turning 65, and so we don't have to worry about that because you're in your open enrollment period. So the only difference between this company and this company is $20 a month. And there's no reason not to take this plan that's $20 cheaper a month over this plan that's not, because all of your benefits are the same. Your company A is not going to give you any less benefits because you're paying a less amount. All of it's federally regulated by the government. So all of these plans, all the benefits are the same. So that's where we have to decide. That's where I'm going to say, let's go this route, unless you want, especially when we're talking about a plan G and a plan G, right? On a plan G, what you are required to pay is that Part B deductible, which we talked about earlier is $240 for the year. So when you go to the doctor January 1st, if you go to the doctor January 1st, you're going to go in and let's say it's a $100 doctor visit. Because you haven't met your Part B deductible, you're going to pay that $100 bill. Then the next time you go to the doctor, let's say it's a $100 doctor visit, you're going to pay that. The third time, if you go to the doctor and it's a $100 bill, you're only going to pay $40 of that $100 because your Part B deductible is $240. Once I've met that $240, then my Plan G comes in and picks everything back up at 100%. Does that sound like a plan that could work for you, Miss Jones? There's where we're going to explain to them. We're going to tell them all those things that when they go into the doctor, because they're going to be paying their monthly premium for that Plan G, but then they're also going to have to pay that Part B deductible. So you want to make sure that you break it down simply for them so they understand, because I said a few minutes ago that you should never receive a doctor bill, hospital bill, anything like that. So they might remember that. And then when they go to the doctor and they haven't met their Part B deductible for the year, that they're coming to you saying, I thought you said I would never receive a doctor bill, hospital bill, or anything like that. Remember, Miss Jones, that I said that you have to pay that Part B deductible every year, and that amount changes year after year. So for 2024, once you pay $240, then you don't have to worry about. Then everything's going to pick up and you're not going to have a doctor bill or a hospital bill. So let's break it down. Let's see which plan that you want, which best suits you. You qualify for any of the plans except Plan F because you aged in 2024, so we can't write a Plan F. So my top two recommendation plans are going to be a Plan G or a Plan N. And what's the difference between Plan G and Plan N? So it's really just the out-of-pocket cost that I'm going to have, and that you're going to have, Miss Jones, for that. And so on this example, we ran a 68 because they might already have it, or maybe they're coming off of group and they're retiring and they're still eligible for open enrollment. But we ran a zip code of 71913, which is my zip code, with a household discount, where most of these carriers these days have a whole household discount where only one has to take the policy. If they're living in the household with somebody, certain age criteria come into factor with that. This is for effective date April 1st. So a Plan G is going to cost you $121.36, right? So you're going to pay that monthly premium plus the $240 Part B deductible. So your estimated annual cost for this plan is going to be $1,696.32. Does that sound like something that you would like to take out this plan, Ms. Jones. Or we've got another option of my recommendations, which would be Plan N. Now, Plan N works a little different than Plan G. I want to make sure that you understand that. So Plan N, if I look at the initial cost of it, is quite a bit cheaper. It's $95.55 a month. I do also still have to pay the Part B deductible of $240. Let's say you go to the doctor one time. You do have to pay an up to $20 copay. And I say up to because that's how it's worded on there, is that some doctor's offices might only charge $5 copay. Some might charge $20. They can't charge over $20 for that. If you go to the ER, you will have to pay a copay of up to $50 for that. And then the biggest difference between the Plan G and the Plan N is, like I said, the excess charges. You can ask your doctor's office, do you accept assignment? Remember, I said 90 to 95% of doctors and hospitals accept assignment, which means that they would come in and I would not have excess charges. But if I have to go to a specialist, or if I have to go to somebody that does not accept assignment, then I am responsible for those excess charges. So I just want you to understand that. Look, my out-of-pocket expense initially is going to be $1,386.60. But that total doesn't include potential copays and excess charges. So that's really important for you to explain. I say this to my clients all the time. Plan N is a lot like what they're used to for major medical. They're used to copays. They're used to, deductibles, those type of things. And they're used to not everything being picked up. That 80-20 split on a major medical plan is that same in most cases. So, they might say, I want to, take that cheaper route of that monthly $95.55 rather than that $121. The other thing that I tell them is you can switch your Medicare supplement any time of the year, right? There is no certain time frames. The only difference is that you have to be underwritten and qualify for you to be able to switch. So if something does happen to your health and we don't know what's going to happen, Miss Jones, you would be potentially not able to switch from one plan to the next. And why would I do that? Why would I need to switch plans? Well, that's because if you have a rate increase or something like that, and every carrier is going to have a rate increase every year. You're not only going to get a birthday rate increase, but you're also going to get probably a across the board rate increase. And sometimes those rate increases get up there to where they can't afford those plans. And so that's the reason that you will see some clients switch from one plan to the next, is simply to be able to save money for them. So it's a big decision to decide, Ms. Jones, which plan best fits you. Whichever one fits you, then we can write that application and get it submitted and get your insurance cards headed your way. So is there anything else that I can help you with? And at the end, if you know anybody else, Miss Jones, that I can help you like I helped, that I can help like I helped you, then please give them my name and number and let me help them as well, right? Asking for those referrals will also at the end is the perfect way, because as long as you've helped them and you've serviced them and you continue to service them, that's how a lot of agents build up their book of business, is based on referrals. So that is my presentation. I did go a little bit more in depth, probably for you as the agents to understand really how to break it down. Thank you guys so much for joining me. Remember, my name is Jennifer Harris. I'm the National Marketing Director here at Eldercare. Have a great day. Bye.